I would like to talk about angle closure analysis using CASIA2. Here is agenda, starting from the conventional angle diagnosis problem, and I will talk important parameter of angle, then moves to angle analysis procedure or application using CASIA2. So, talking about glaucoma exam, we will check IOP, fundus image, fundus OCT, visual field test. And in the angle exam, although inspection can be performed using slit lamp, UBM or OCT, but using gonioscopy is considered the golden standard. However, there are problems with examination using a gonioscope because it is time-consuming, requires experiences, and places a heavy burden on the patient. Because of these reasons, it tends to be performed only on carefully selected patients, and sometimes patients with narrow angle may be overlooked. And another problem with conventional angle exam is that normal values for each parameter in glaucoma diagnosis are not determined. Although many angle-relating parameters have been created and used, it is unclear whether the measurement values are large or small because the normal values have not been determined currently. Therefore, we developed the application that makes it easier to understand the condition of patient's angle by taking advantage of OCT to capture images of the angle without contact easily and quickly. Here are features and benefits of using CASIA2 angle analysis applications. By using this application, angle condition can be confirmed at the same time of other examinations, and prevent overlooking narrow angle patient. In addition, it can be used as a basis for deciding whether to perform an examination using a gonioscope. It is easy to understand the angle parameters referring with the standard values implemented in CASIA2. Furthermore, it is sometimes difficult to get agreement of treatment from patients who have no symptoms, but image comparing function or angle-related application screen are easy to understand and help to explain the importance of treatment to the patient. And this is an example of recommended clinical workflow. After measurement, perform a total analysis first to check for any abnormalities, and move on to STAR application. Then refer to the STAR application, perform gonioscopy if necessary, and then proceed to a doctor's diagnosis. Regarding measurements, we recommend using lens biometry in cataract protocol. This is because if you measure with lens biometry, you can use this data for total analysis too. And during measurement, the width of the eyelid opening is important for observing the angle using OCT images. Observation is not possible if the eyelid overlapping the angle. So, please open eyelids approximately 8 mm or more to use STAR analysis. Also, as a preliminary setting, please set the installation environment of CASIA2 from the system setup screen. This is because the standard values used in STAR analysis is vary depending on whether the pupils are open or closed, which means the measurement performed in the light room or dark room. Before explaining the details of the application, I would like to explain the important parameters in angle analysis. AR means angle recess and SS means scleral spur. AOD is the length of a line from the cornea to the iris. AOD 500 indicates the distance from 500 point from SS to the iris. TIA is the angle of angle recess. ITC is a parameter called iridotrabecular contact, which represents the contact between the trabecular and the iris. In CASIA2, it is expressed as percentage of contact or area of the contact. It is easier to understand with an actual device, so we will take a look at it later. When it comes to scleral spur, it serves as a reference point for various parameters, but it was difficult to judge the point. With CASIA2, we succeeded in improving the accuracy of SS determination, which has also greatly contributed to improving the accuracy of analysis results. Additionally, there are cases where the angle appears to be open, but the SS is actually closed, such as in cases of neovascular glaucoma, NVG, and peripheral anterior iris synechiae, PAS. In such cases, experience may be required to evaluate OCT images, but the automatic detection of SS positions supports this evaluation. In the case of the photo on the right, at first glance it appears that the angle is pretty open, but the automatic judgment of SS positions reveals that the SS part is actually completely closed. Next, we will move on to an explanation of the CASIA2 glaucoma applications. This is the chart display of STAR 360, which is installed as standard software. There are photos of the 8 directional angles, and a chart are shown in the center. Simply speaking, the blue area in this chart indicates that the trabecular and iris is contacting, which means like the angle is closed. The red circle in the chart indicates the scleral spur point, and the green line is the angle recess. So, if the green line is outside the red circle means that contact between trabecular and iris is observed in such part. And the blue dot circles are points of 250, 500 and 750 from scleral spur. When you press the sector button, the percentage of trabecular iris contact angle as well as its area will be shown. So it is possible to understand ITC quantitatively. This is a screen of the optional application, STAR analysis. At the top left, the analysis results are displayed as the narrow angle index, which indicates the suspicion of narrow angles as a percentage. By quantifying it, it becomes easier to understand the condition of the angle. The center chart shows whether the corners are open, narrow, or closed by color. Also, since the condition of the pupil has a large effect on the angle, the bottom right of the chart shows the image was taken in lightroom or darkroom. In the center on the left side, the position of the SS is pointed on the anterior segment picture, and whether it is open, narrow, or closed is indicated using the same color coding as the chart in the center. Let's take a look at each one in detail from next page. In the narrow angle index area, the narrow angle suspicion is displayed as a percentage. If it is between 0 and 13.8%, it is displayed in green, indicating that there is low suspicion of a narrow angle. If it is 13.9% or higher, it is displayed in red, indicating that there is a high suspicion of a narrow angle. The numbers next to it indicate the total angle that could be used for analysis as well as the angle which were determined to be narrow. In addition, total angle of narrow angle and closed angle is shown below. Next is the chart in the center. At each angle, green indicates the open angle, yellow indicates narrow angle, and red indicates closed angle. It's a little hard to see in this picture, but the yellow line shows the reference value AOD 500 for each angle, and the black line and numbers mean AOD 500 of this patient. So, the chart color would be yellow or red where the black line is coming inside of the yellow line. The dots displayed on the anterior segment picture indicate the position of the SS and the angle condition. The colors have the same meaning as in the previous chart. It is said that the SS position is basically on the circumference, so if there are points that are clearly not located on the circumference, an abnormality in the SS automatic analysis is suspected. In that case, please modify the SS on the Image tab. Here are the steps to fix the SS position. Go to Image tab and press Semi-Auto button, then specify the SS points on the each 8 angle photos. Once you have specified the SS, press the SS OK button so that the reanalyzation will be performed automatically. This is the details of the reference value used in STAR analysis. The 5th percentile of AOD 500 of normal eye data was used as the reference value for the narrow angle. This value differs between bright and dark places. In addition, the standard value of the narrow angle index was derived as the optimal value from a data using diagnostic results obtained by glaucoma specialists using gonioscopy, etc. Here is the reason why the reference value of AOD 500 is different in a light room and a dark room. This is because the angle becomes narrower as the pupil widens, so the reference value is also get lower in a darkroom setting. Also, as to why STAR analysis uses AOD 500, the current situation is that AOD 500 is used as a representative value for the angle parameter. So which means in the future, as research on glaucoma and angle using anterior segment OCT progresses, we will consider changing to more appropriate parameters if they become available. Finally, I will introduce some cases. This is a comparison of the STAR 360 chart and STAR analysis for normal eyes and eyes with narrow angle. On the left is the chart display of STAR 360, and in the patient below, a blue area can be seen in the chart, and we can easily identify trabecular meshwork contacted to iris. However, we do not know how severe it is, whether the areas that are not blue are within the normal range, or whether narrow angle is suspected overall in this patient. And the right side is the STAR analysis screen. You can see that there is a clear difference from normal eyes and narrow angle eye as same as left charts. On the other hand, the narrow angle index makes it easier to determine the overall suspicious of narrow angle. And STAR analysis also makes it possible to see that there are many areas where angles are narrow, even where contacts are not observed. Here is the image comparison screen. We can see the angle is getting narrow on the right picture of patient. Although this is not limited to glaucoma, comparing images side by side with normal eyes makes it easier to tell the abnormality to the patient and is effective in explaining the importance of treatment. Here is summarization. STAR analysis allows you to easily understand the suspicion of narrow angle using numerical information. Since it enables us to check angle condition at the same time of other inspections, it is possible to reduce the chance of overlooking a narrow angle. This is useful for deciding whether to perform gonioscopy, which is a time-consuming process. By explaining to the patient using application screen, it is easier to gain consent for the treatment. Thank you very much.